We as doctors get so frustrated when we recommend, when we know a therapy, when we know what a patient needs, and we know we need to have a diagnosis to help us get them that need met, and yet we run into an administrative economic barrier that is not anticipated. My mom is 92. She's in an assisted living facility, and she has high blood pressure. She has memory challenges. She has a history of thromboembolic disease and on a number of medications that are quite important and required for her day-to-day safety and health. They said, well, we have a new Medicare Advantage plan for your mom, and it requires prior authorization for these medications. And I said, she's been stable on these medicines for the better part of a decade. She has substantial medical issues. She's had to be hospitalized before when her medicines aren't right. I'd like for her to continue. Oh no, we're not allowed to continue. They must be prior authorized. And so I had to then reach out to the pharmacies and had to reach out to her family medicine doctor, and we had to go through a substantial amount of effort. These are generic medications. She's stable on them. We'll find that we have to call for a prior authorization, and we can't do it electronically. We actually have to call on the phone, the old-fashioned telephone. We have to call an 800 number, some number, and then we have to give them all the data. We have to give them the insurance information. We have to give them the patient's date of birth, things like that. And then what they do is they give us then an authorization to fax them the information. So I've called them to get permission to fax them a request. And then once they've got it, I've got to call them while they discuss the fax. That's another barrier and obstacle to care that's incredibly time-consuming, has no value added, and it seems antithetical to trying to get prior authorization. What I really am getting is a prior authorization to get a prior authorization. I cannot imagine the burden that the average patient and or the caregiver runs into if they don't know some of the nuances of this. I had a patient earlier this year that had an episode of continued dizziness. He has a Medicare Advantage plan, and the Medicare Advantage benefit manager denied the MRI that I'd ordered. And it took me a week with a couple of phone calls, faxing again, the documentation of what had happened before that radiology imaging procedure was approved. That's just so frustrating to not only to patients, but us to doctors. We need to hold accountable with legislation the benefit managers and the insurance companies so that patients are not put at risk, and doctors can have confidence that their recommendations for treatment, diagnosis, and therapy will be followed. What we as doctors, what we as patients, what we as caregivers can do to impact prior authorization right now is to share our stories. The AMA has a website, fixpriorauth.org. Use that website, share your story, call your individual state legislators, let them know your concerns, give them your stories with healthcare, with prior authorization. You can make a difference, but they need to know about it in order for them to make a difference.